Hi everybody, I'm Angela Hart. Welcome to the Heart of New York show. As you know, we've been doing a series of shows that help seniors, inform seniors, and also help caregivers in our community. And so I've asked my co-host, Eli Goldbaum, to join me today.
Thank you. How are you, Angela?
Very good to see you, Eli. And we've also invited some guests on the show who are from Independence Care System. And so we're going to have each of the people from this organization, which is a nonprofit healthcare organization, introduce themselves, starting on my left.
I'm Nettie Harper, and I am from Independence Care System, as you mentioned, and I am the program director for our dementia.
Thank you.
My name is Bob Paradiso. I'm a rehab engineer for Independence Care System.
Thank you. We'll be talking a lot about how the Independence Care System has access for seniors who need help with light engineering issues in their home, and it's a wonderful service that you offer. And you, would you like to introduce yourself?
Sure. My name is Dee Visco. I'm the director of our wound care team at Independence Care System.
My name is Danny Perry. I'm the Director of Community Engagement at Independence Care System, also known as ICS.
Thank you, Danny. Welcome, everybody.
Thank you.
I thought it would be helpful for the viewers to understand what an MLTC is, managed long-term care, who qualifies, how do they enroll in such a program, and how do they come into existence. So I thought we'd ask our Medicaid MLTC expert, Eli Goldbaum, to give a little bit of a historical background for the viewers.
Okay. Thank you, Angela, again, for having us as part of the team. So an MLTC has actually been around quite some time. However, about, I think, 2011 is really when the MLTC world really changed in a big way. It used to be that people got their care through what was called CHA, which is a Certified Home Health Agency, and they also obtained care through what's called ELIXIR, which is a Licensed Home Care Agency. But what evolved was the way the reimbursement to the providers changed, as it used to be what was called fee-for-service, where people billed Medicaid directly. So Medicaid changed a system whereby the reimbursement from Medicaid goes to the MLTCs. There are currently, I think, 21 or 22 plans left in the state. A few of them had been absorbed by some of the larger plans, but they all, there's these, like I said, there's 20 some odd plans, and each of these plans that get reimbursed from Medicaid per member fee per month, and they are responsible to take care of a lot of the services that we're going to be talking about today to help the members in the community. So that's a basic gist of what an MLTC is. It's sort of a reimbursement to help the individuals in the community get the services that they require, whether it's home care services or a slew of other services that, like I said, we'll be discussing.
So a senior person has to be on Medicaid already to get onto an MLTC, right?
Correct.
And is it we hear about community Medicaid and long-term care Medicaid. What is the difference for the viewers?
Very good question. So community Medicaid, and that's really when someone goes on to MLTC, typically they will have community Medicaid, which is a Medicaid that has practically not much of a look-back period as far as assets, which is something that is surprising to many people, that there really isn't a look-back, or there's a 1 month look-back of assets. So really, if someone did certain transfers of assets, they would be eligible to get onto Medicaid for community-based services, and that's when they would then go and attach themselves to an MLTC, and they would be entitled to have those services. At the point that they require long-term services, namely a skilled nursing facility, which is a nursing home in the old lexicon, and today it's known as skilled nursing facilities, for rehab or whatnot of any time, any length of stay, it would also typically be done through an MLTC, although there is some fee-for-service as well, a component to that. And they would be required to give a 60-month look-back period, which is 60 months, 5 years of financial documentation to show that they are eligible for the programs. And obviously, this is probably not the right format to discuss the eligibility of every nuance of the transfers, but there are ways to deal with transfers of assets, and there are certain times that there will be penalties or whatnot that will prohibit a certain period of time that they would be ineligible. A lot of people think that it's automatic 5 years. That's not correct. It would depend on the amount of the transfer. And, again, depends on how much a person will transfer, what the assets were, and how you deal with that.
So there's a lot to understand about these things, and that's why we have to continue to learn through experts such as Ellie and the panel here about the services and also how to qualify for them. So thanks, Ellie. Okay. So let's hear from Danny a little bit about how your organization started and what your mission and your vision is.
Sure, thanks so much. So Independence Care System, we were founded in 2000. As Ellie had mentioned, we are a nonprofit managed long-term care plan. We're dedicated to supporting older adults and people with physical disabilities, providing the needed home care, health care, and social services so that people can remain in their homes and be as independent as possible. So we're similar to other plans in that we provide an array of services. We talked about home care, but also transportation and medical appointments, dental, vision, hearing, occupational, physical therapy, and so forth. But what sets us apart is that we have a number of unique specialized programs and services. For example, we have a comprehensive wheelchair program. We have a wound care and prevention program, which we're going to talk about a little bit later. A dementia program as well. We have assistive technology services. We also, for example, have a care transition program for when people are in the hospital and they transition back into the community. So a whole host of services that go above and beyond what the state requires, and all free of charge to our members.
Wow, tell me about the wheelchair program. What did you call that?
So we have a comprehensive wheelchair program. Approximately 40% of our members are wheelchair users. And so when someone comes on and they're a wheelchair user, they get assessed by a rehab specialist, and they'll do a full assessment for them, a seating assessment. Also, we take into consideration environmental situations in the home. So if a person has a narrow pathway, we'll take that into consideration in terms of the type of wheelchair that they'll receive. We also have wheelchair techs that can go into the home and fix the wheelchair. If it's not able to be fixed on site, we'll give them a backup wheelchair to make sure that the person stays mobile. We also have community-based wheelchair clinics where people can come in and get their wheelchairs repaired as well. So that's a unique service that we provide that's specific to ICS.
How many of those wheelchair service centers do you have in the 5 boroughs, as an example?
So we have 2. We have one in downtown Brooklyn, and we have one in our Bronx office.
Do you plan to have them in the other boroughs as well?
Right now, that's where we're at, and so who knows what's going to happen. But right now, we have our main one in downtown Brooklyn, and we make sure that people can come into our wheelchair clinics. And as I mentioned, if a person happens to be homebound, we have wheelchair techs that can go into the home and help service the person in their home.
And so are most of the wheelchair-bound people in electric motorized wheelchairs or manual?
We have a mixture of people, and actually I might pass that on to Dee, because Dee works with the wound care team, and they kind of work hand in glove. As you know, people that sit down for long hours at a time are more apt to get pressure ulcers, particularly on the buttocks. So maybe Dee would have some more information pertaining to that.
I think it's probably fairly well mixed. For those, there are a lot of, especially more of our younger population, who want the independence of manual wheelchairs, as well as some of the seniors could not operate the power chair, it might be too complex, where a caregiver is pushing them. So I would say it's fairly divided depending on the individual's need, their physical ability, and the ability of their caregiver.
Thank you. So what else can you tell us? Wound care is an important topic with seniors these days.
Absolutely. Pressure injuries, they used to be referred to as pressure ulcers or decubitus ulcers, are injury to the skin or death of the skin that results from prolonged sitting. Subconsciously, all of us here, we shift, we turn, we move without realizing it. For those, especially the seniors, who cannot reposition themselves, who cannot get up from this chair and take a few steps to allow the blood flow to their bottoms. For folks with physical disabilities, the longer you stay in one position, the more likely your skin is going to start to die. The longer the immobility, the more significant that ulcer or injury to the skin can become. Anywhere from a superficial redness to something all the way down to bone.
Wow.
So it can be very, very significant.
And how does this impact the people's lives? I mean, do they get hospitalized and rehospitalized? What happens?
Significantly. You can have anywhere from infection that requires IV antibiotics to surgical debridements to remove the dead skin to hospitalization. Unfortunately, the mortality and the morbidity or death from pressure injuries is very high.
Really?
Data will tell you close to 60, somewhere in the 60,000 individuals per year can pass as a result
That's
of their
very surprising.
skin
Does that
injury.
surprise you?
Not really, because you're talking about, like she mentioned, it's down to the bone. So you really you have. I remember years ago we were looking into a device that had like a cushion that pulled out, so there'd be a hole in, let's say, the padding, where the cubitus, or however you the wound, would be sitting on this empty spot as opposed to being resting on a surface that was actually hurting the wound. So in a sense, that when you're dealing with wound care, it's not an easy.
It's very complex, and the key, although we have a full, one of the very unique things about ICS is that we have a wound team. I don't think there's another MLTC in the city that has a wound care team. There are 4 of us, all board-certified wound specialist nurses, who work with those who have developed wounds, but also, and probably more importantly for the seniors, is working with the families, the caregivers, the home health aides, the personal care assistants, to prevent. And education is always the key. Essentially, we use a tool called the Braden Assessment, which looks at every individual's risk factors. Based on how they score on that tool, we then put in a plan of care that's very aggressive for prevention. Do you need a special cushion for your chair? Do we need to work with the wheelchair team to really customize that and optimize that for your daily routine? Do you need physical therapy, occupational therapy, work with a nutritionist? There's a whole array of things that we can do up front so that you never get that wound. And to us, that's the key. We have, when we look at our statistics for the number, and Danny could probably tell you exactly what our census is, but on an ongoing basis, we have about 40% of our entire population is at risk, which is a very high number. Are those, out of that 40%, less than 4% each year go on to get a new wound, which is incredibly low. Statistically, you'll see numbers in the 9 to 12%. So we've been very, very effective at aggressively preventing. And again, it's education, and it's not just the 4 little nurses. It's an organizational philosophy that we've adopted, and that comes from our president down.
Oh, I love it.
When I first came, I've been at ICS since almost its inception, 16 years now. And when I met with Rick Serpin, who's our president, he said to me, I don't want anyone to have to ever suffer from this. You tell me what we need to do to prevent it.
Kudos to Rick Serpin.
Yes,
Is that his last
yes.
name? Rick Serpin, we think you're great. If you're looking out for the well-being of seniors to this extent, this is a well-run organization.
Yes,
That's good to hear.
That was our first meeting. He said, Dee, you tell me what we need to do to prevent this. And from that moment on, it's embraced by an organization, everyone from Bob to Nettie to the specialty programs to our social work care managers to the coordinators of the team to our transportation department. If you ask them about a Braden score or a risk, they're all going to know what you're talking about. They're all going to understand the importance of getting the cushion, getting the wheelchair fix, getting the individual what they need in order to prevent it. So for us, the key is a very aggressive organizational way. It's almost a philosophy or a guide to practice for us, because we don't want to worry so much to get them where we have to treat them, although we will be very aggressive from that front. But really, if we can prevent, then that's better quality of life for the senior. That's less pain and suffering. So
A
that's
lot of
really where
times-
we're focused.
A lot of times you come on to the MLTC after you already have that wound.
We have many who come to us with, and not one, we
Yeah, I'm
have
sure.
some up to 12.
12 wounds
Down
on
to the
one
bone.
senior's body?
Yes, so very significant, having been in different care situations. And in that point, that's when my team is more focused. That's when we have the wound care nurse specialist who's out really working with the physician, working with the member, working with the caregiver to optimize their ability to heal. Let's get them to the right physician. Let's get them proper care, proper nursing in the home to do their dressings, because we want to keep them out of the hospital and we want to get them healed as quickly as is possible.
And many people think about wounds, they think of wheelchair users and wounds on their buttocks, but a senior who's bedbound or someone who has dementia, and I'm sure Nettie can talk a little bit about people who have dementia and their possible opportunities of getting wounds there. And so there's a lot of focus, not just on our community of people with disabilities, but also with seniors as well.
And I was actually about to go to you next to ask you, how does that come into play with respect to the people that you see in the dementia
Sure.
department?
Sure. So we do have an entire team that's dedicated towards individuals with memory impairment. So we have nurses and we also have care managers, and they're all certified dementia practitioners, and we made a commitment as an organization to what kind of training can we provide. So it's not just saying, well, we have a team that's dedicated towards individuals with memory impairment. It's really like, what is the training? Because we can't be the experts unless we understand the disease as well. And then the second commitment we made is it's not just about understanding the disease, but it's about understanding that these individuals are humans and they need to still have meaningful lives. So when we go out, yes, we're looking at the symptoms of the individual, but we're also looking, how do we get them back and connected with their community? And so where wounds come in is when we go out, most times is the home health care agencies that we work with, so often they're worried about, well, we don't want the individual to fall, or they might hurt themselves.
Yes.
Because they're so supportive and caring, what happens is the individual ends up not doing anything, and then they're sitting in a chair all day, and if they're sitting and not moving, as Dee said, then we develop those wounds. So the job of the dementia team is, yes, let's educate the home health aide, let's educate the family care partner, but also let's give life back to the individual with the memory impairment. So can they get out and go to the parks? I mean, New York City has so many free things that we need to bring back into their lives. There's music all over. And so that's kind of where our team practices, is how do we get them connected again? And how do we ensure that they feel like they're making decisions again about their life? And so we focus on giving their life back.
Giving them empowerment. And that's what I like about what Bob is going to demonstrate for us later in the show, about empowering the seniors to be able to control home items. And did you want to speak a little bit about technology for a bit?
Sure. I think what I definitely hope people take away from the demonstration later and in our conversation today is that there's a range of things that can be done, and there is actually a large amount of things that can be done very affordably and that are easy to set up by almost anyone in your family with just a little bit of time. Things to allow a person to turn lights on and off, fans, air conditioner, even if they have limited hand function or possibly even significant paralysis just using their voice. And these are things that are out there. They're consumer items at this point. People are using them for convenience, even if they do not have disability, but for people who do have, who are either elderly or disabled, they can get a lot of mileage out of these items. So I'll be happy to show those off later.
Thank you. So are there some stories that anyone would like to share about some seniors that have benefited from some of these services? How about you?
Sure. Yes. I just want to kind of tie back into what Bob said. So many times we're told that individuals with memory impairment can't learn, and so we've had significant success with remotes to where you just put a little tactile where it feels a little bit rougher, and so many times people will say, well, I want the TV on, and then the aide has to go turn on the TV. Well, I want it off, or I want the channel changed. And so what can happen, that can be a little tiring, and also it takes away the independence of the individual. So we actually can label the remotes, and then we can teach them through a space retrieval process on how to use the remote. And it taps into their procedural memory, and so people with a memory impairment can still learn. And I think, using the devices that Bob uses and really educating the aide that people can still learn and they still can have that independence, because now we have people with a memory loss using remotes.
Well, while we're on the subject, what is the difference between Alzheimer's and dementia for the viewers? If you'd like to speak to the camera and share, because many people are concerned about their loved ones because they're exhibiting certain signs. What can you tell them to educate them?
And that's a very good question. What we need to understand is that dementia is an umbrella term, which means it's a bunch of symptoms. And then Alzheimer's disease falls under that umbrella term. So Alzheimer's disease is a disease. However, there's over 100 dementias that actually exist. And some of those dementias are reversible conditions, and some of them are not reversible conditions. So such as Alzheimer's disease or frontal temporal dementia, or you may hear dementia with Lewy bodies. Those are not reversible conditions, but then there's other dementias that are out there that are reversible, such as depression can actually resemble an Alzheimer's disease, but that can be treated, and then the person can return back to baseline in their cognitive functioning.
Well, when we go into segment number 2 next week, maybe you'll share a little bit more about that. I'd like some more information about that for some friends and relatives that I'm concerned about. Thank you for coming on the show, everybody. And next we're going to have a short demonstration with our resident engineer who goes into people's homes that are part of the Independence Care System organization as members, and he actually helps them become more independent, and it's a great way to end the show. Thank you for doing that for seniors, and thank you for coming on the show.
Thank you.
Thank you for having us.
He's going to give us a demonstration now about these items on the table, and supposing that I'm a senior, and I'm not a senior yet, supposing, he's going to demonstrate how they're activated through voice and through remote control.
That is correct.
So tell us, how would the voice control know which item? Would I say a white table lamp, a black fan? What would I do if I were a senior?
So I want to show kind of 2 categories of things, as you mentioned. I want to show some remote control stuff and the voice activated stuff, which you just mentioned. So first the remote control, I'll show those together. This is for the situation where you have a person who still has some hand function. They can use a remote, but they have trouble either getting out of their bed or out of their wheelchair, so they can't get to the item. They can't actually get to the lamp or to the fan, but they can hold a remote. So in this case, I'll use this remote to control this light and this fan. So in this case, I'm able to turn the lamp on, I can turn the lamp off, I can turn this fan on, as you see, and I can also turn the fan off,
Now,
like that.
As a senior at home who has dexterity issues and mobility issues, also vision issues, I'm sure, sometimes, how would I know which button is controlling which item?
Right. That can be a sticking point. So in this particular setup, what we do is each item gets a row, and then there's on-off on each row. So what we do normally is we'll either put a piece of colored tape or a label or whatever is easiest for the person. Sometimes there's a sticker we put on that has some texture to it, so they can even just feel it. They don't even need to, it's not even sight, it's just feeling it. And that cues them into which one to press.
So for instance, maybe you could put some blue paint on the second button and maybe put a big blue circle on that, and they can remember, oh, it's blue, and it controls the thing that has the blue on it, such as the TV?
For sure. Every case is a little bit different, but for example, that would work just great.
Wonderful. So that would be the remote control. And how many items can the remote control affect?
Sure. So there's many different ones on the market. So again, everything I'm showing here today is off-the-shelf things you could just order off of Amazon or buy from a store. And this particular brand, it lets you control 5 different things from the same remote. You could, of course, get a second remote to control another 5, but this particular remote, it's 5 in one go.
And how many items do typical seniors living at home or in an assisted living have programmed into one of those?
You know, I find that one remote of that sort is usually about right. Usually they'll have a few lamps, a fan, maybe a space heater, for example, and that about do it.
Did I hear you tell me once before that it can also control the blinds, the window blinds, or is that a different remote control system?
So some things that are larger motorized type things, such as blinds or a hospital bed, that's more of a custom job. So this demonstration is more of the off-the-shelf. You could buy it real quick, and anyone from your family could set it up for you very easily in, just 10 minutes. They could just plug it in, and it's good to go. Window blinds and stuff is a larger setup, but that can be done.
Okay. Now, are these remote control devices, are these being used in nursing homes as well as at-home use for seniors?
I'm most aware of their use in the home setting, but there's nothing that precludes any particular environment from using them. All that it requires is when you buy this, you get this remote, and you get this little box. It's this little white box about the same size as the remote. It plugs into your wall, and then where you were plugging into the wall, you plug into the box instead. So anywhere that has outlets.
Oh, that sounds like a
can
very
use.
easy setup for just about any handy person.
It's very, very straightforward.
Okay, let's do the fun stuff now. How does the voice activation system work?
Sure.
Can you demonstrate?
I'll demonstrate that. So what I have on the table here to demonstrate for the voice is that other fan, lamp, and then this TV. So we'll give it a go. Alexa, turn on lamp.
Okay.
Alexa, turn on fan.
Okay.
That's fantastic.
And now I'm gonna turn off those two things, and I'll show the TV. Alexa, turn off fan.
Okay.
Alexa, turn off lamp.
Okay.
That's excellent.
So now I'll show the TV, if we have a minute for that. Alexa, turn on TV.
Okay.
So what this is turning on now should be both the TV, and underneath the TV there's a DVD player there. With I have a DVD in there, so what I'll show once it starts up, the DVD, once that starts up, that is, I will show it playing the movie, because you can also control the movie through your voice. You can control play, pause, stop.
That's
all of that.
fantastic.
Alexa, play.
Okay.
And now it starts playing. Alexa, pause. You can see it
Okay.
pause. I'll even go to the next scene.
Please.
Alexa, next.
Okay.
And now it's gone to the next scene. And just to kind of close the loop, I'll turn it off. Alexa, turn off TV.
Okay.
And there it turns off. And so there's a lot you can do with that. This type of setup lets you control anything that originally had a remote, such as your TV or DVD player, or if you have a radio stereo system, anything like that. Air conditioner, things that had a remote, but you don't have the dexterity to press those buttons anymore, or the vision, or whatever it is. It lets you use voice
How
for those
is the
things.
Independence MLTC involved with the sale or promotion or introduction of the remote control for seniors?
So we try to, Independence Care System tries to, of course, increase the independence of its members in whatever way it can. So what we're trying to do is, by giving them these these are extremely affordable items.
How much?
We're talking, let's say, $50, another $60. Let's say for, between $100 and $200, you can do a lot. And actually, in a limited case, if you just want a remote, that's like $30. So actually, sub $200, and in some cases, sub $100, you can let a person from their wheelchair be turning a lot of things on and off, changing a lot of things.
Having independence, which is a
Having that
wonderful name for your
independence, yeah.
organization. But who pays for it? Do you pay for it for the seniors, or do they have to fund it themselves?
So there's a budget. When it fits within budget, which it often does, we do buy these things for seniors, and members of our organization. When we actually do also provide installation services in some cases where it's outside of budget, they can afford it, but then we help them get it set up. The install is very easy, but sometimes they don't have a family member or someone who can help out, so
Yeah.
we'll help out.
Yeah. So, Bob, who would be the person at Independence that a member would contact to get this? Would it be a case manager, or who would they contact?
Right. So the workflow is that they have their care manager put in a service request for engineering services, and then someone like myself will be sent out to assess, see what would most benefit them. So, to speak with them, see what they're having trouble with, see what is that gap between what they wish they could do and what they want to do, and then buy those things that will fill that gap.
I had no idea that an MLTC would provide engineering services to seniors, so I'm getting to be even more in love with your organization to helping seniors.
Yeah, no, it's a great organization, and yeah, I hope that a takeaway is also, though, if you don't have access to that organization or similar, that you at least know this stuff is out there.
Yes.
And if you have the means, that you do take the steps to get it if you're interested. A lot of people don't even know it exists. So to at least show people it's out there, please set yourself up with it.
So, viewers, we wanted to leave you on that note to know that if you have a loved one at home that needs to have access to such a product, that they exist, and if they're not on an MLTC already, first they have to be on Medicaid to qualify to be on an MLTC. But if you're considering an MLTC membership, certainly Independence is one that wants to make a senior become more independent.